Welcome everyone to this Global Positive Health Institute podcast series. My name is Dr. Liana Lianov, and I'm excited to welcome today Dr. Shagufta Feroz, who serves on our GPHI Advisory Council, serves on our international team. She's a family medicine physician. She has a PhD in holistic medicine and integrative medicine. She completed a fellowship in integrative medicine from the University of Arizona and is also certified, board certified in lifestyle medicine. And what we share is a common passion not only for lifestyle medicine, but for positive psychology and how it impacts health. And that's what this series is all about. So a perfect guest for us. So welcome, Dr. Feroz.
Thank you. Thank you very much for giving me this honor, Liana.
Wonderful. It's always a pleasure to talk to you. And so, yeah, let's dive in and share with us what brought you to this passion for positive psychology and well-being.
Okay. Actually, I was not aware of this positive psychology about 15 years before, I would say, but the void, the vacuum in my practice, I started thinking about something which can make my patients happy, because I used to see a lot of patients besides everything I was doing for them, but I could feel that I was not able to handle their stress. Even by putting them on antidepressants, I was not happy with their progress. So that was the time where I started thinking about what else we can do for them. So that was the time. My practice forced me to think about something which can make them happy. But I was not aware of this term of positive psychology.
Yeah, that's also, I can relate to that. I think I had an interest in this area to help support people, help them become their best selves, help them flourish. But it took a number of years before I discovered that my interest really aligns with this scientific field of positive psychology. And when I discovered it, I was so excited that there was a name to it, a field, and there was some incredible research going on that really can inform all of our well-being. So tell us a little bit about how you use it in your personal life and how things have developed for you.
Okay, so I was doing, I can recall that I was doing a health show on a very national TV channel, and the anchor asked me, tell us something which can make this nation happy, because that was the time when our nation was going through the great trauma of those terrorism and terrorist activities. So when he said to me, and he said, don't tell us something very expensive, because people can't afford expensive interventions. So I couldn't answer his question, but came back, then I started thinking, what should I do for my nation and for my public? And that was the time when I started reading about laughter therapy. And I started talking about laughter therapy. Rather, I used to write on my prescription that you have to sit with the children and you have to tell your children to share jokes with you. That was my primary, intervention, which I have started doing in my patient's life.
Yes, and I presume you started with yourself. Do you do laughter therapy for yourself?
Very true. Yeah, you are right. Because I felt that my professional burden was too much. And we, as you know, that doctors, we don't get time for ourselves. But I make a point. I told my children that share all the comedy programs. I wanted to see the comedy program. So I used to allocate about 15 to 30 minutes to watch anything which used to make me laugh. So I practice that. I do that. Still, I do that. When I'm exhausted, I make a point that I have to watch a laughter program.
Yeah. Laughter is good medicine is an old saying. And in this case, what you're talking about also in terms of sitting down with children or family and laughing together is basically we're experiencing together happy emotions, positive emotions. And that actually is a very serious part of the science of positive psychology is this concept of positivity resonance. So it not only makes us feel emotionally better, mentally more healthy, but it actually has those physical benefits, because when we're experiencing these positive emotions at the same time as other people, it actually lowers our blood pressure, our cortisol, our blood sugars, and it's literally is therapy. So that's a wonderful example of how you got into this field. I remember a few years ago, I used to think about this, and I thought, nobody's really doing this. So I'm happy to this laughter piece. I'm happy that you're a front runner in it.
And I got so excited when we had a laughter therapy session in our fellowship class. And you imagine the session was conducted by a cardiac surgeon.
Wonderful. That is music to my ears, because and it was music to my ears when you said that you're prescribing this laughter therapy with your patients, because of course that's what I'm passionate about, is how to help the healthcare team, healthcare practitioners really incorporate this into their treatments with patients. And you're one of the I like to say early leaders and a front runner in this area. And I'm so grateful for your work and helping us to lead this and make it serious. And clearly we always do our work on the shoulders of giants, and there was someone who introduced you to it, and yes, that's wonderful. Yeah, and I went to a happiness summit a number of years ago in Australia, where I was introduced to laughter yoga, and I didn't know what that was. And so it was during the lunchtime break, and I thought, what is this? So I went and joined the group. They were all in a circle, and all together we would start doing this laughter. I thought, this is kind of silly. I don't know, it feels a little fake. But then as I saw others laughing, I joined in, and this group laughter was amazing. It felt really amazing.
Yeah, I can feel that. I can feel that. How would you have been feeling there?
How else do you use positive psychology or other aspects of positive psychology, either in your own life or with patients?
Okay. Gradually, I learned that everybody has got their own way of getting happy. So one thing which I have found common in my patients and for myself also, that we humans are blessed with a default de-stress system. And I call it a default de-stress system, and that is your hobby. So the tendency to do something with the tendency which we are born with, we always forget to follow our hobbies as we get mature. So whenever a patient comes to, like I would like to sing when I was in my teenage. I stopped listening to good music. I was into doing adventures. So I stopped doing that. So about 2 years before, I have gone to Niagara Fall. I have done this zip lining after 30 years probably. So doing adventures. So what I do, besides activating my hobbies again, which have helped me getting better performance in terms of physical body or in terms of mental body also. But when I ask my patients, what were your hobbies when you were a teenager? I always see a smile on their face, and they will always say, Doctor, now we don't have the time to indulge into those hobbies. What are you talking about? Then I tell them, okay, you start allocating 10 minutes, 15 minutes, or 20 minutes to your hobby, and you will feel better. So this is one thing which always makes my patients happy, because it is there inherently in them.
I'm really glad you mentioned the option of engaging in hobbies as a positive psychology intervention. And for those listeners that have been following us, we've introduced this framework of the PERMA model from Martin Seligman, who's the father of positive psychology. And that's a P for positive emotions, E for engagement, R for relationships, M for meaning, and A for accomplishment or achievement. And E, the engagement, is also called flow in the positive psychology literature. And we can get into the state of flow when we are engaging with our hobbies. And then we're one with that hobby. It gives us this either calm feeling or positive feeling. We're working on it. We're losing track of space and time. So we kind of forget our troubles for a few moments. And it's a mindfulness state that is so therapeutic. And that's, of course, if it's a sweet spot where we're doing this activity that we're needs some concentration, but not so much that we want to give up, or is just so rote, something we just do all the time, that it becomes boring. It's just that sweet spot where we concentrate just enough to keep us interested, excited. Our whole mind and body is one with the activity. And it is such an important positive psychology therapy.
So true, very true, very true. And it's so easy to implement also.
Exactly. And we say in the United States, the sky's the limit, because so many things can fit into that bucket of engaging us and giving us a sense of flow, so that we can be individual about it. There's also a term called person activity fit in positive psychology. So we encourage people to find those activities that are a good fit for them, that give them that sense of either if you're seeking calm, mindfulness, or seeking a little bit excitement, zest, some up emotions as well. So terrific. Yes. And I know that you have been a leader in putting together for professionals and others some training. You have this happiness summit. Tell us a little bit about that.
Actually, when I heard about this happiness summit for the very first time, which was probably organized by Texas University in 2018, I was very excited to organize. And I know you, I always look forward to you, Liana. So I thought that I have to organize this happiness summit without having an idea what I will be doing in this happiness summit. But I had three objectives in my mind. Number one, to introduce globally the softer image of my country. I wanted to introduce the music and the culture and the very rich tradition of Pakistan to the people globally. Number two, I wanted to give people very simple tools to understand how to make themselves happy. And my third target was to bring the very important celebrities of Pakistan who have already attained a very iconic status, and we interviewed them. People were aware of their personalities and their stature. And when they were talking about happiness, Liana, believe me, I was shocked to listen what they were talking. Actually, they were describing positive psychology without even reading about positive psychology. So when I have organized the last year's summit, the comments people gave me, they thought I took the services of a very professional event management company. And I got some comments from UK that, how did you manage this? And the interesting comment was that there was so much synchronization between the science, because there was doctors also, and there were general public also, the important people from general public. So the comments were, there was a synchronization between the scientific people and the general public. So it was for 14 hours, 2 days summit. And people said that we were glued to our seats. We would not like to leave a single moment of this summit. And same response this year also. Last year, there were about 1,400 people watching the summit. Wow. And this year, there were about 1,500 people watching the summit virtually.
Amazing. That's amazing work. And congratulations on touching the lives of so many people. And then, of course, it has the ripple effects because some are practitioners that are then bringing it to their patients, or others who are bringing it to their family and friends as they're getting excited and learning about and becoming passionate like we are about what positive psychology can do. And you're doing such a great job of getting the word out, and that's why I'm so grateful that you're on our advisory council, as I said in the beginning, and you're on the international team. And I didn't point out that, yes, you are joining us from Pakistan, and we have members of our council from over 20 countries and growing, and that is the goal of the Global Positive Health Institute. And also what you're doing is because we are now a virtual world. So much of what we can do is virtual, and anyone can participate. We'll have to talk about how maybe we can bring some more audience to your conference and vice versa to our GPHI conferences.
Yes. Yes. Two more new things were added to this year's summit. One, we have added a happy walk one day. This was on 18th March. We had 2 days summit, so we organized a happy walk also. And I gave awards. I thought an idea of award. So one doctor, which I never thought that he'll be so active is in this summit. He is a cardiologist, interventional cardiologist. I'm supposed to be a very serious person, but he has done so much to spread this message that I gave him, our association gave him the title of Dr. Happy. And then we were presenters, we have presenters who are doing so much charity work. They are doctors. So the title was Angels of Happiness. So I felt that there was a sense of competition amongst the team also. They now probably will be working more full of their heart. I mean, they'll be more excited next year. This is my feeling. And this was the idea which I got on the very last day, that I should announce something for the participants.
That's wonderful. And hopefully we will get a chance, and we're getting our audience interested in what you're doing. And so stay tuned through the Global Positive Health Institute and our website. We will certainly make announcements about next year's summit and all of the wonderful programs that are actually popping up all over the world. Yes, you just mentioned that actually this past weekend, at the time of this recording, was the International Day of Happiness. And there are a number of groups that like to organize events around that, including the summit in Pakistan. There was also, believe it or not, a Ukrainian group. There is a Ukrainian Institute for Happiness Research, and they also did a small virtual conference this past weekend, and I spoke at that. So it has, of course, that has so much meaning right now as we're all looking to support our common humanity and help our fellow men who are suffering. And the idea of being able to use positive psychology as a tool for improving mental well-being during turbulent times has been something I've been really thinking about. And there's so much more we can do as all of us collectively around the globe are facing some difficult times. So as we talk about positive psychology and happiness, it is important to say that we are recognizing that the field of positive psychology is actually embracing all emotions, having that self-compassion, helping people to have self-compassion, to have compassion for others, kindness, and it's not just about happy, it's about all emotions, and then shifting as best we can, considering the circumstances, to looking at things as more optimistically as possible, but yet realistic yet optimistic. And so I've been thinking a lot about that lately, and so actually we're going to have an event that actually focuses strictly on this use of positive psychology for our mental and physical health during turbulent times.
Okay. Nice, very nice.
And so clearly there is so much that we can do with other colleagues like yourself in other countries to do the same thing.
Yeah, definitely. I would love to join you.
And so we've just been talking about resources like this summit that you're helping to lead, that our audience may be interested in, the events that the GPHI is going to be offering. These are wonderful resources. What are some other resources that you would recommend that our audience check out if they're interested in learning more or really applying this for themselves or their patients?
Martin Seligman, I started reading about him and little literature from him. And I've done a short certification from Harvard Extension Program. They offered 2 weeks certification in positive psychology. And then I definitely follow what you are doing. So these are my resources. That is all I can tell you.
Terrific. And I actually am really looking forward to doing some work on different cultures and positive psychology. One resource that we put together with the American College of Lifestyle Medicine is that mini textbook, Roots of Positive Change, Optimizing Healthcare with Positive Psychology. And it just gives some practical ways that clinical teams can use positive psychology in their personal well-being, as well as when they're talking to patients, as well as in their prescriptions with the treatment plans that they offer to patients. And I am very aware that there are these cultural differences in how these kinds of interventions are received, that different interventions may work better with different groups. And we talked about that a little bit during our conference in 2021. And so we're going to be building that section of our textbook. And because you're an international guest here, would you like to comment on those cultural differences?
Okay. You want to know the culture in Pakistan regarding the positive psychology or happiness?
Yeah, just as an example of how it's a little bit different there than in the United States, for example.
All right. So in my country, for happiness, we need to have our family together. So we don't feel happy when the whole family is not there. So we prefer to enjoy happiness at a collective level, number one. Number two, we always incorporate some spiritual or religious activities with our gatherings. And we feel very, relaxed or comfortable or secure when we add some spiritual or religious activity to our gatherings. Like if there is a wedding, on day one, we will be doing some religious activity to have that wedding to have blessings in that wedding. So collective activities are preferred here. Then charity is very, very important part of our culture. So it is religiously promoted, and culturally, we as a nation are in a habit of giving charity. I don't think we are very kind people, but I feel that we are into charity giving. We are a charity giving nation, and we can't, even if I am short of fund, but if I see someone in need, I will definitely offer whatever I have. So charity is a very common practice of us as a nation. And then we have got some sense of humor also as a nation. So whenever we are together, we have to have some singing sessions or some humor is going on, and food is very important component. We enjoying the elders of our family, they play a very important role, and they have to cook their traditional foods. Like one dish which I would like to name it, the biryani. Biryani is a rice dish, which is a very traditional happy food culturally. So whenever we are together, we are going to request one of our elder members that you have to make biryani so that we will enjoy together. So food, laughter, music, rituals, religious or spiritual are the combo of one happy gathering.
Wonderful. It sounds so inviting and warm, and clearly represents the heart of positive psychology, which is good feelings that are shared, as we've been talking about. So
Yeah.
thank you. Well, we're near the end of our podcast. Do you have any other last comments anything else you would like to add?
First, I would like to compliment you and say thank you to you that you are doing a great job, great job. And may Allah bless you to do more. And I would like you to, rather a suggestion that spirituality should be part of our positive psychology, because spirituality is not restricted to any area. All of us feel very elated when a spiritual component is added. So spiritual practices like collective meditation should type of these types of things should be there. I feel very, very happy when something, even if when I am there in US to attend my residency, and if there are spiritual sessions, those are the sessions which are the bestest ones which I would remember up till now. So this is my suggestion.
Thank you, Dr. Feroz, Shagufta. And yeah, I absolutely believe that spirituality is an important component of positive psychology, and there's good science behind it. In fact, from our conference in 2021, we have a wonderful lecture by Dr. Gail Ironson at the University of Miami, who does this research on health outcomes of people who consider themselves spiritual or have this religiosity component, and they have some nice measures that are validated to measure how spiritual someone is, and then to measure those outcomes. So for those who are interested, yes, please check out. We'll have that in our positive health course, which is coming out later this year, where we will address that spirituality components. But thank you so much for bringing that up, and we should do more of that. So again, thank you so much for joining us today. It was a pleasure. And thank you to our audience for following this podcast by the Global Positive Health Institute. And we look forward to seeing you at another one of these in the future. Be safe, be well. Take care.